Hello everyone, and welcome to your Health Choice. I am Dr. Roopnarine, and we're coming to you live from our studios at Olira Heights in San Fernando. We'd just like to wish everyone a happy new year. This is our first live program for the year, and today is the 11th of January 2023. So guys, on tonight's program, we'll be discussing skin diseases. And in studio with me tonight is Dr. Shiva Tewari. Dr. Tewari has a master's in clinical dermatology, and Dr. Tewari is also a specialist medical officer in dermatology. As usual tonight, guys, our numbers should come up at the bottom of your screens, and we will do our very best to answer each and every one of your questions during the program. So guys, welcome back 2023. Let's talk about our skin, and let's say hello to Dr. Shiva Tewari. Dr. Tewari, it's a pleasure to have you. Welcome to Your Health, Your Choice. Thanks for coming on the program tonight, Shiva.
It's my pleasure to be here.
Yeah.
Thank you very much for having me, and thank you to all of our wonderful guests for taking a little time off your busy day to spend a little bit of your night with us to learn a little bit more about the skin and your skin health.
Great. So Shiva, I mean, let's just get straight into it because we have a lot of information to put out there for the public, and obviously we'll be taking some calls later on, some questions and messages later on in the program for you to answer as well. So Shiva, one of the most common skin conditions in adolescents, teenagers, and young adults all over the world is acne, skin acne. Now, if you could just, I mean, when you go to the pharmacies, you see loads of products out there. There's a million different things, especially in the US pharmacies, and people buy stuff over the counter and put it on the skin hoping to get relief for acne. If you could just basically just give us a little bit of guidance, tell us what is acne, what's the best way to treat it at home, and also when it's time to see a dermatologist, and what can a dermatologist do for those patients that have severe acne? So it's a pretty loaded question, but just take us through acne a little bit.
Sure. So acne is one of the most common conditions we have on the face of the earth.
Yeah.
Almost everyone at some point in their life is going to have some manner of acne.
Right.
So if Josh would be so nice for us, could you just put up slide 4? So you could do 2 seconds on slide 4, then slide 5, then slide 6.
Yeah.
So acne comes into a lot of different categories.
Yeah.
So you have your basic acne like this, which has a lot of blackheads.
Right.
Next. You have your whiteheads.
Yeah.
So a lot of these buttons are quite small. You have the little pustule ones we call pustules.
Yeah.
Next. But then you also have the severe forms, so what you call nodulocystic acne.
Right.
There are even forms of acne that can put you into the hospital for treatment.
Okay.
They're not common, but it's good to be aware because some people will suffer from these.
Right.
So in terms of, okay, so what do we do for acne?
Yes.
Well, the first stage in most acne is you get blockage or clogging of the pores.
Right. So we're talking about like the regular teenagers who.
The regular
I mean, is it that the majority of teenagers get acne? Because it seems to be like I remember when I was a teenager, I had acne. All my friends had it.
Yeah. So during time.
How common is it in teenagers?
It is absolutely common. I think about 97% of teenagers are going to get acne.
Right.
So you can say virtually everyone.
Right.
The severity is going to vary based on a lot of different types of factors.
Right.
The blockage of the pores would be the first problem you have. Now, blockage of the pores is going to happen naturally, but as you said, what can we do to help prevent acne, help not make it as bad? Well, some of the things, some of the activities we do on a daily basis will clog pores.
Right.
So, simple things. If you're on your cell phone a lot for the day, you're physically blocking the areas. You're pressing on the pores and you're increasing the chance of blocking them up. If you have your hair on your face all day, if you have a lot of products in your hair, that can cause the issue. Same thing happens when you're sleeping. If you have your hair under you when you're sleeping, it's on your face, you can block your pores, you can trap a lot of that dirt and that oil, and that essentially is going to lead to the blockage.
Okay.
So what we can do, as you said, with the products, so what are we looking for? Well, we're looking for a lot of products that are going to deal with exfoliation, things that are going to open up the pores a lot more. So if you're looking at basic products, over-the-counter, things you don't need a prescription for, there are a few washes that have that exfoliating effect. The most common one, and probably one of the best ones, would be salicylic acid.
When you say exfoliated, what do you mean by that?
So for exfoliation, when you have so you have the top of your pore and you have a little bit of cells, dirt, grime, and so the exfoliation effect is a gentle taking away of that top layer of skin to reopen the pore.
I understand.
So one thing that a lot of people make a mistake with is they treat their face as if it's a piece of wood and they have sandpaper. They're taking on many, many, many layers. But that's not what you want when you want to treat acne. In fact, when you're very harsh with your face, you aggravate the skin. You increase inflammation. And by doing that, you may, yes, open up the pores, but then you end up with a lot more redness, a lot more pain, a lot more irritation.
Right. So you're saying the exfoliant that you use is not necessarily one of those abrasive ones. You don't need that sort of abrasive exfoliants. And you were mentioning salicylic acid, and that's an exfoliant.
Correct.
So how does a person use that product?
Right. So most of the products will come with instructions as to how to use it. The most common that you would tend to see would be a wash.
Right.
So they can come as basic washes, foaming washes.
Right.
The instructions will usually tell you how long to leave it on for.
Right.
But in my experience, they're very similar.
Right.
You take it, so lukewarm water, not very hot water, not cold water, lukewarm, because you are opening up the pores before you do it.
Yeah.
You rinse the face gently.
Yeah.
You take the wash, you lather it up.
Yeah.
Gently, circles, light circles, not scrubbing, just a nice gentle movement. You leave it on for about a minute or so, and then you gently just wash it back off.
Okay.
When you're finished, you don't take the towel and scrub either. You take the towel, you pat yourself dry. Again, trying to limit the amount of bacteria that comes to the face, it should be a clean towel.
Okay.
So the clean towels will prevent accumulation of bacteria to put back on your face after you've done all the cleaning.
Okay. And is that a routine that people should do every night who have acne?
Not just every night. So it depends on your severity of acne, of course. So if you think of it, you've spent your entire night sleeping, whatever oils have come out, whatever dirt, bacteria is there, it's going to be on your face first thing in the morning. So I do recommend you wash first thing in the morning, you get rid of that.
Okay.
Then throughout the day you are going to work.
Yes.
When you're at work, not just the things that come from inside the body, but we have all the little dust, the Sahara dust, the concrete dust, the pollen, the pet dander, all the emissions from the cars. These things are in the air. They are going to land on your skin. So when you come home in the evening as well, as soon as you reach home, I recommend rinse your face as well.
Okay.
And then there's going to be a few hours passing before you go to sleep at night. You can do a gentle rinsing.
Okay.
Now the problem with the medicated washes like the salicylic acid, if you overuse them, they can dry out the face.
Correct. Yeah.
Some people, they have no issues, and you can use it 2-3 times a day, absolutely fine.
Just be careful not drying out your skin.
Correct. But if you do have a little bit of a drying effect, you simply get a sensitive skin or a hypoallergenic wash, and that is going to do the job for you. So you will get the same wash. You won't have as much of an exfoliant effect, but you'll definitely have the cleaning effect to clear the dirt.
So I suppose what you described there, the theory behind it is that you're washing away the stuff that blocks up the pores.
Correct.
And if you wash away the stuff that blocks up the pores, you're less likely to get pus and form the acne. Is that correct?
Correct. So the oils that come out of your skin, the bacteria, that's what they feed on. Now, as we know, a flowing drain doesn't smell, but a stagnant drain smells. So if you block that pore and you trap all of that oil in there, the bacteria is not getting washed out anymore. It stays, it's a buffet. You have a lot of space to feed, and they multiply.
All right, so before you go on to beyond the wash, obviously we're going to discuss what kind of sort of topical stuff to put on and more significant treatment. What, other than the, I mean, traditionally, you would think that, maybe you might be wrong, that teenagers get it because of changing hormones. Sometimes, you always tell the older folks saying, so stop eating so much KFC and oily food, maybe too much chocolate and those kind of stuff cause it. Does diet and hormones contribute to acne?
So hormones, 100%.
Okay.
So most people are going to get acne during the time in their lives where you have that sudden change in hormones. So teenage years, during pregnancy, and then during menopause. So quick changes, your body doesn't adjust very well, and you are going to get a little bit of acne more than likely. Diets. So one of the old myths that we have was, well, your skin is really oily. So if you eat oily foods, it comes out in your skin, it triggers acne. We found that not to be correct. But what does have an effect on acne, diets high in dairy products and diets high in sugary foods, especially simple sugars, tend to trigger worse acne.
All right, so I guess the old housewives or grannies, recommendation of not eating certain sugary foods and so on was actually based on some science as well.
Absolutely.
All right, Shiva, if you could just go on there, because you've told us about cleaning the face to prevent it, you told us about certain foods to avoid. If you could go on to tell us about how do you actually treat this person now beyond the wash who has bad acne.
So over the counter as well, so we're still dealing with mild acne.
Yes.
You have some spot treatments.
Yes.
So a lot of these will contain benzoyl peroxide.
Yeah.
They may have a concentrated azelaic acid or sometimes mandelic acid.
Yeah.
And you may have something that's called adapalene, which is a compound made from vitamin E.
Okay.
Now, a lot of those compounds, they're quite harsh. So if you have button, you don't rub it all over the face.
Okay.
You actually touch them and touch the areas with the buttons because they're quite concentrated, they're quite strong.
Right.
So
It could hurt the normal skin, in other words.
correct. So
Correct.
overuse of it, a little bit is good. It's like salt in food.
Yeah.
A little bit good, too much spoils the pot.
All right. Now, Shiva, I mean, it's great to say put the medication on a pimple, right?
Right, correct.
But I think it's very hard. I mean, people growing up, you always hear people saying, don't squeeze the acne with your hands because you'll damage your skin and you'll leave a scar.
Right.
Is that true?
So to a great extent it is.
Yeah.
So usually what happens, so you have your flat skin,
Yeah.
you have acne that starts to form.
Yeah.
So you have a little bit of inflammation and the skin starts to pull up a little bit.
Yeah.
Now when you pull up, eventually the pressure gets so high the body has to release it.
Yeah.
And it opens ever so slightly, it lets out a little bit of pressure and it closes right there.
Yeah.
So it's very unlikely you're going to get any scars from that.
Okay.
However, if you come and you grab and you pull open the area, you make a much bigger wound.
Which is basically squeezing the pimple.
Correct.
Yeah.
So now the skin has to find itself as it's healing. And you can absolutely heal flat with no scars.
Correct.
But many people heal with a little bit of a mound or they heal with a dip.
Yeah.
And I'm sure you've seen people who, it looks like somebody took an ice pick and gave them a few jabs into the cheek.
Yeah.
Those are known as ice pick scarring. And a lot of that comes from bursting the buttons because you've created this dip. The body's priority is not to look good. The body's priority is to heal.
Correct.
So if the quickest way to heal is down like this, you're going to end up with a dip in your skin, and those are pretty permanent.
All right. So it's just being devil's advocate, so to speak, right? But it's the reality of what happens out there. So somebody has bad acne, looks unsightly. Let's say not bad acne, a teenager looks unsightly, they might have a pimple on a real sensitive area like the nose or the forehead or something coming on TV or something like that. You're telling them, don't squeeze it.
Well, to an extent I am. I do have one right now that I was tempted to squeeze before I came
but you
on
tell them
here.
don't squeeze it because it can damage your skin.
Right, so the question is, are you looking for the quick fix or are you looking for the long term?
Right.
Because yes, you might fix it for today, but then for the next 20, 30 years, you're dealing with that scar and you can't squeeze out the scar.
The scar's
scar's there for a long time.
Right.
So the good
Permanent.
thing, it's
Possibly
pretty,
permanent.
so they do ease up with time, but yeah, they're pretty permanent.
All right. So your recommendation for someone right now, sitting down at home, a teenager who has to go out to a party with a pimple on their forehead and going, oh my gosh, is use the adapalene or use the salicylic acid. Or what was the other topical you named?
So we have benzoyl peroxide.
Benzoyl peroxide. I wouldn't give the people the trade names because we're not endorsing any particular brand. But those are the chemicals that you recommend that people use.
Correct.
And those would pretty much, how does it get rid of the pimple?
Right. So
Antibiotic in nature or how does
so most of the ones we'd call no, so it wouldn't be antibiotic in nature.
Okay.
Now, the reason that I would recommend that, if you keep a good skincare routine, you'll know you have these acne buttons. If you use the topicals, many times between 2 and 5 days, they're already going down.
Right.
So it prevents you from having to burst at the point of the party.
Okay.
Things like the benzoyl peroxide, they're quite drying. So they pull a lot of the oils, they do dry up these things. The vitamin A derivatives like the adapalene, they help in the normalization of the production of skin, and they do tend to create a little bit of that exfoliant effect.
Okay.
And with that, they do shrink. I mean, I use these things myself.
Right.
I've had big ones, and 2-3 days, they're almost gone. They're not noticeable.
All right, so that's someone with mild acne. So we have people out there in the population who probably did not seek medical attention, who have significant acne, and probably still using topicals and not being happy. They just fed up,
Right.
and they just forget about it, or they condemn themselves to living with this thing until they get older or whatever. When should they come in to see you, not you in particular, but a dermatologist, and what would a dermatologist do for them?
Good. So acne is very personal.
Yes.
So I might watch your face and say, your acne is mild. I don't see a big issue.
That's nice.
But that's because it's on your face.
Correct.
If it was on my face, it would be a much bigger deal.
I understand.
So the point
There is an emotional and psychological and self-esteem component to it as well, especially in the top in the modern world.
Yeah.
Where it's all cosmetics and looks.
Correct. And it's cosmetics, looks, it's pictures, it's a lot of these social media sites.
Yeah.
How you look is how people judge you, and that's just life.
All right.
So if it is you have acne that's bad enough to affect your quality of life, you see someone.
Okay.
So whether or not other people think it's bad, if you think it's bad. Now, I've had patients who have come with very bad acne, and I come expecting they're going to, that's what I'm treating. And they come and they have the tiniest of mole there, and the acne doesn't bother them.
Yeah.
In that case, we can take our time and treat.
Yeah.
But we have other people who have a couple of buttons, and to them, they are getting depressed.
Yeah.
So if you're reaching to that level, absolutely see your dermatologist.
Good point.
Now, what we would do, usually, if you've crossed the topicals, you're going onto tablet medications.
Right.
So we have more short-term and we have more long-term.
Yeah.
Now, the short-term medications usually involve some manner of antibiotics.
Yeah.
Now, understanding how these work, many times they will get the acne under control.
Yeah.
After that, whether you stay under control is very individual.
Yeah.
So catching a dog running around in the yard is pretty easy.
Yeah.
When it gets out in the road, good luck.
Yeah.
So if you can get that dog back in the yard and lock that gate, that's the antibiotics. It puts it back there.
Yes.
And many times it'll stay there and you might be good for 6 months, a year, even more.
I understand.
But for some patients, 2 weeks later, the dog is back out in the road, the acne is back out under control.
And that's where the specialist goes in
Correct.
and determines whether to increase the medication, the antibiotic, change it around, combine it.
Correct.
Or what to do.
And in worst case scenario, we do have a bit more complicated medications.
Right.
Overall, they're quite safe if you use them correctly.
Yeah.
But using them correctly involves testing bloods before you start.
What type of medication? We could just name it because I'm sure it's out there.
So it essentially is one of the vitamin A derivative medications.
Which is it Roaccutane or?
Correct. So the chemical name will be isotretinoin.
Right.
It'll come under many different brand names.
Right.
But yes, so those are the popular ones that we have, and they're almost all along the same lines.
Okay.
What they do, they have a fairly permanent effect of shrinking down the oil glands.
Right.
Now remember, the flow of oil is what causes a lot of this acne problem.
Right.
So if you shrink down the glands, you have less acne. It's as simple as that. When you take it, many patients are good for years.
Okay. So I want to interrupt you again, Shiva, right? And just because that's real salient points. Why, I mean, we've gotten guidance as general practitioners that these patients who are using these vitamin A derivative, Roaccutane, should be seen by a specialist and placed on it. So therefore, we don't want these people getting it easily over the counter.
Yeah.
We want them to avoid that. Why is that? Why educate the public as to why these things need to be delivered by a specialist dermatologist, these more advanced treatments for acne.
Right, and to be honest, I have seen quite a few of these patients, and in our country, you can get many things over the counter you're not supposed to.
Yeah.
Without calling names, in fact,
things happen, right? It's everything happens.
You can get anything pretty much over the counter if you know the right people.
Right, but why is it that they can't take it?
So what's supposed to happen? You need to know the protocol as to what to do. And many patients, they start the medications without checking, is it safe to start first?
Yeah.
So you need to know what you're allergic to, because some allergies are going to cross over onto those tablets.
Yes.
You need to know, is your liver functioning well? Because the tablet is processed out through the liver.
Yeah.
One of the potential side effects it can have, it can shoot your lipids or your cholesterol, your triglycerides, the fats in the body can shoot it up quite a bit.
Right.
So it's not just take a tablet and give it. You need to have a checklist.
Yeah.
You go through each of these and you make sure, okay, it's safe to take the tablets. When you give the tablets, you also come back and you check to make sure the patient's body is tolerating it correctly.
Right.
I've had twins that I put on these medications and one is absolutely fine and the other one comes and the cholesterol is through the roof and we have to stop. They're the same size, the same age, the same genetics, but you have to be careful. I personally know a medical professional who took the tablets for themselves, ended up in ICU. So
yeah, basically you're saying it's these highly specialized drugs for acne, they work fantastic, but it needs to be done under medical supervision.
Correct.
And for the reasons you just put forward there, you know. So Shiva, time is flying by. We have to take a break, a commercial break, and when we come back, we push on a little bit about the keloid scars, moles, skin cancers, those sort of things. Guys, so we're here with Dr. Shiva Tewari. He's a dermatologist. Feel free, just like to formally invite you to send in your questions on skin diseases to us here, and Dr. Shiva Tewari will do his very best to answer them as best as he can. All right, guys, so we'll see you back in one moment.
everyone, I'm Stacy from Stacy's Kitchen. Check out our new episodes, Season 3 of Stacy's Kitchen at our new time, 5:30 p.m. on Mondays and Wednesdays, right here on ACTN The Voice. I will be whipping you up some flavorful and appetizing dishes. As they say, good food makes a good mood. So guys, stay tuned for this culinary explosion right here on Stacy's Kitchen.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Dr. Shiva Tewari. We're talking about dermatology, skin diseases. And feel free to join in on the conversation, ask your questions, let the doctor put forward his guidance to you. So, Shiva, we just discussed acne, which was a really informative discussion on a problem that affects up to 97% of teenagers, as you were saying. So, Shiva, something that is very important as well is, I spent a lot of time living in Ireland and England and studying, and it was very, it was almost daily messages on the radio and through the public health systems about the sun and about skin cancer. And obviously in Australia and countries like that, the public is heavily educated about skin cancer. And obviously I think it's because their population being Caucasian. Relate that to us. Are we at risk in Trinidad and Tobago from the sun? Does it damage our skin? Is skin cancer a problem here in Trinidad as well? Educate us about that. You understand the drift I'm getting at?
Yes,
we need to hear the message about the sun and the risk of cancer. Is there a problem here in Trinidad?
So there absolutely is a problem.
I mean, we do have a Caucasian population. Majority of the population is non-Caucasian. So, but does it affect non-Caucasians as well?
So I think that's one of the problems in the way we look at skin cancers.
Yes.
We expect skin cancers are a problem with the Caucasian people.
Yes.
And but we're not. We're Caribbean people. We are blacks and we are browns.
Yeah. And every variety in between.
Correct. So we have a lot of deeply pigmented people who think, well, because of my pigment, I don't have to worry about skin cancers.
Yeah.
In fact, we have a lot less than the Caucasians, but it's much more easy to miss. So so I have seen, and I've seen a fair amount of numbers of many of the different types of skin cancers.
Yeah.
And for all those who are not going to have it, wonderful.
Yeah.
But for the few that are, if you miss it, it can have life-changing consequences if you live it too long.
I get your point. So you're basically seeing as a diagnosis that could be missed, terrible consequences.
Correct.
So tell us a little bit about skin cancer. How do we check? How do we protect ourselves from it, and how do we check for it?
Right. So in terms of checking for it, I've put together a few nice little slides here.
Yes.
These are actually from the American Academy of Dermatology.
All right. Can you just call them up, Josh? Which one it is?
We can start at slide 11, please.
Yeah.
And we've made it literally as easy as the ABCs.
All right.
So as
this is looking at moles, is it?
These, right. So moles and skin cancer are kind of grouped together.
Okay.
Because when moles start to change, generally it's skin cancer you're looking at as well.
All right.
So you have a lot of benign changes, and then so you can have things that are just there. They're pigmented. They're not normal, but they're also not worrisome.
Right.
And then you have the things that are worrisome, which are skin cancers.
Yes.
So I've put these rules here for you.
So this is basically people with moles that you're showing us how to
So yeah, so you have moles, but again, a lot of things for skin cancers, they tend to come as pigment, but I'll go through some things that even with the ones that don't have deep pigment still apply to. These are what you look for skin cancers, whether it comes from a mole or not.
All right, Josh, you go ahead and put that back up.
Right? So A is for asymmetry. So if the lesion is very well defined in terms of it's a nice shape, it's very circular, it's very oval, it's a nice usual left equals right, it's very unlikely you have to be worried.
Right.
Next, please. So B is for the border.
Yeah.
If it is your borders, you know exactly where the lesion starts, you know exactly where the lesion stops. That's wonderful. If you look at the margins, they're a bit blurred, you're not quite sure how big it is.
Correct.
That's a lot more worrisome.
Right.
Next, please. So C is for color.
Okay.
If it is, you have multiple colors in your lesion, that is far more worrisome than if you have one or two colors. So one color, wonderful.
Right.
Two colors, acceptable.
Right.
Three colors, pay much closer attention.
Okay.
Next, please. So D is for the diameter or the size.
Yeah.
If it's about 6 millimeters or less, very unlikely to be worrisome.
Okay.
But once it grows a bit bigger than that, you tend to have a little bit more of an issue.
Right.
Now, you're looking at what have things always been as well. So if you have a lesion that since you were small,
Yeah.
takes up a quarter of your hand,
Yeah.
and then you've grown, so your hand has doubled in size, but the lesion still takes up a quarter of your hand.
Yeah.
Even though it's gotten bigger, it hasn't really gotten bigger proportionally.
Understand your point.
So that's a lot less worrisome.
Right.
But if as you get bigger, it goes to half, three-quarter, even
That
your
means
whole
the lesion
hand,
is growing.
that the lesion is growing, and that's something you definitely take into account.
Okay.
All right, next, please. Good. So the last one we have, and probably the most important of all of them, is evolution or change.
Right.
So if you've had a lesion for the last 5, 10, 15, 20 years,
Yeah.
it's always been one size, it's always looked a certain way, and all of a sudden, it's suddenly getting bigger, whether it's horizontally or vertically out of the skin. If it's starting to itch, burn, bleed, pain, it's starting to ulcerate or get that dip to the skin, then that's something you definitely want to check because it's moving differently. The other thing is what we call the ugly duckling or the black sheep sign. So you have multiple lesions. They all look the same way for the most part, and you have one. So everybody else has a nice certain skin color to them, but one of them is a different shade. Or all the others have a nice pigment to them, and one is not pigmented, it's normal skin color.
Right.
That one that stands out, you should check that a little bit more
Right.
carefully.
So what I get from you there, Shiva, is that, I mean, people don't normally have one mole alone. There are people that have multiple moles on their body.
Yeah.
So they really need to know the moles on their body.
Correct.
And they need to check it. What is the rule for checking the amount? Like, I mean, some people have several hundred, they have
Yeah.
20, they might have 10. What's the rule sort of way to check them? Not and understand the characteristics that you're worried about that might indicate danger. But how often should someone check their moles, and should a professional check it for them?
Right. I don't think you need to absolutely come to professional for your moles. If you've gotten a small number of moles over time, multiplied by a long time, you'll have a lot of moles. But if all of a sudden, over the course of a few weeks or a month or so,
Changes
you
happen.
suddenly have a lot of moles coming out and you never had that, yes, absolutely get that checked out. That is a little worrisome. Now, there's a trick. So if you want to track your mole progress, you can take a ruler and you can put it right next to your moles, and you take your phone and you take pictures. And that way you never have to guess the size of it. So if you come back in 3 months, 4 months to just do a reassessment, you look at the picture, you put a ruler again, you measure it. If it's around the same size, it's not really changing, you're safe.
Right. I would just like you to repeat those symptoms or characteristics that you said that might indicate danger. It started with itch.
Itching, burning, bleeding, pain. So most times people won't have to tell you. People will notice. So they will say, okay, you know, this has never bothered me before, but all of a sudden it's growing. It is getting either coming out of the skin, it's going deep to the skin. There are symptoms that weren't there before, bleeding and pain especially. You can get intermittent itch, and that's probably not too worrisome. If it's itching all the time, that's a little bit more so.
Okay.
But really, itch, burn, bleed, pain, growth, those are big things.
So this person now comes into you and say, Dr. Tewari, I heard you on the program, or my dermatologist, I've heard on the program that these moles, when they come itchy, burning, bleeding, that something might be up. So I'm here. What happens next to them?
Right. So as with all patients, what should happen is a full history and a full physical examination. So the doctor should give you a question base of basic medical health. There are certain signs that we would look for, things like weight loss, changes in bowel habits, sometimes joint or bone pain, especially in the back. And we look at those, okay, so those are symptoms that are associated with new moles. We may be a little bit more worried about things happening. Now, the symptoms by themselves can be pretty normal. I mean, many people have back pain.
Right.
So by itself, maybe not an issue, but that's why the doctor needs to put everything into one little category and link everything together.
And then is there any investigations that happen?
Yes. So there's a nice little device called a dermoscope. It's a high-powered magnification device with an internal lighting source. It gives different types of light, polarized and unpolarized, which helps show different features.
Yeah.
And it it enlarges sometimes 10, 20 times the size.
Right.
So your doctor can take a really close look of the area, features that you'll never see with the naked eye, the pigment network, how regular or irregular these are. Regular is good. Irregular things that are all over the place may indicate something is a bit more worrisome. And if it's worrisome, the next step is, if in doubt, take it out. And then we send it to the pathologist. They look at it under the microscope and they come back and tell us, this was nothing or this was something. If it was something, did we completely take it out or did we not?
I understand.
If we took it out completely, good, end of story. If we didn't take it out completely, we come back and we take a bigger slice and then we check that again to make sure we keep taking slices until we've taken out the entire thing.
All right. So this would more or less be melanomas that you're describing.
So melanomas are the common one everybody knows of. There's something called a squamous cell carcinoma. So those are the top layers of the skin if they go a little bit awry. And then you have the basal cell carcinomas, which are the ones that come from the skin cell factories, which are a little bit deeper down in the skin.
All right. So that's a change in the skin that's happening, and you pick up on it and come into you. How can we prevent these things from happening? Is there a way to prevent them? Give us the guidance to prevent skin cancer. In Australia, so we all see the cricketers and those people and those English and Australian cricketers heavily sunblocked because they spend the whole day in the sun. What is the guidance for us in the Caribbean?
Right. So, I mean, we're right above the equator. So, just like Australia, we have a culture that's heavy into going out into the sun.
Yeah.
We have carnival coming up.
Yeah.
We're always at the beach.
Yeah.
We're out, we're playing cricket, we're playing football.
Yeah.
So, one of the things is you can't avoid the sun
Yeah.
in our kind of climate. But
Yeah.
what you can do is mitigate how much of that sun damages the skin.
Yeah.
So, as you said correctly, sunblock.
Right.
That is the best thing we can do.
Right.
Usually what you're looking at is at the SPF or the sun protection factor. That's a big number on the sunblock.
Yes.
30 at least, especially for the face. But if you get 50 is usually what I tend to recommend.
Right.
So if you accidentally put on a little bit less than you need, it's a little bit more strong than you actually need, so it evens off and gives you a good protection. Most sunblocks in bright sunlight, they last for about 2 hours.
Right.
So you just wipe them off and you reapply.
Right.
Blocking that ultraviolet radiation, that extra radiation damages the nuclei or the area where your DNA is in the cell. And when that's damaged, that's what contributes to a lot of skin cancers.
And I suppose it might get worse with climate change as well, because you might get higher proportions of UV light coming through to the citizen on the ground.
Correct. So the more ultraviolet radiation we have, the more it's going to happen. So you can have your chemical means of blocking, which is your sunblocks, but you also have your physical means. Which cricketers, if you watch the umpire, there's a huge hat over there.
Yes.
Right? So physical blockage, long sleeves,
Yes.
long pants, you have umbrellas, you have hats. You need to remember as well, so if you have an umbrella overhead, if you're in an area and you turn off all lights, if it's still bright, sunlight is still coming through. So sunlight bounces off all the glass. We live in a world of glass. Cars, buildings, shiny surfaces, metals. So maybe only 10% of the sun's rays are bouncing sideways. So your umbrella's here and you get it here. But imagine, what if you're sitting in an office near a window and it's 10% over 8 hours?
Yes,
Well,
that's
that adds up,
concentrated. Yes, of
right?
course.
So you
Or a
should...
taxi driver with his hand on the windscreen, on the
Correct.
window,
They
all
always
day
come from
long,
the next
all
side
day
as
long.
well,
Yeah.
Right? And I actually have a really nice picture that's similar to what we see from the taxi driver's point of view.
Yeah.
What I would recommend is the sunblock, because it's direct contact with your skin. No matter which direction the rays come from, it blocks it.
Right.
So sunblock is really the main thing you're going to do, not just to prevent skin cancers. It actually makes you age more slowly.
So
Because
that brings me to the next question. What else does the sun, what other harmful effects does the sun have on our skin other than cancers?
Right. So cancers is when your skin starts to grow abnormally.
Yeah.
But you also have a lot of damage
Yeah.
that comes from your ultraviolet radiation.
Yeah.
So ultraviolet A and ultraviolet B are the main ones we're looking at.
Yeah.
And they break down a lot of the collagen. So your collagen is your scaffolding for your skin. This is what holds everything nice and in place.
Yeah.
And if you break it down and that collapses, you end up getting skin that sags, it comes down a bit more.
Yeah.
You get a lot of wrinkles, especially early in
I think
life.
you have a picture as well.
I do. So, could we get slide 17, please?
Yeah.
Right. So this was a case that was put forward in one of the medical journals.
Yeah.
Now this case is a 69-year-old truck driver. So similar to our drivers who are on the road all the time. So in his cabin, the left side of his face always faced the window. and the right side of his face was shaded from the inside.
Right.
Now, this was wonderful in terms of his genetics, his diet, his environment, everywhere else was exactly the same. This is the same person
Yes.
at the same time.
So you could really assess the...
You can see that face is about 30 years different from one side to the other. And here's the thing about it.
Yeah.
That's only the radiation that came from the side.
Yeah.
Windscreen radiation, so all the stuff that came in from the front damaged the other side.
Right.
So had he used sunblock on one side alone, he would have looked
complexion
even
would have-
better.
Yeah, wow.
The skin is sagged, there's a lot of wrinkles, it's
Yeah.
damaged.
It
so-
really looks like an older person on the right hand side or the person's left there.
Yeah, so
Yeah.
that is how much of a difference sunblock can make, and even bigger than that, because
Wow.
he didn't use sunblock on the other face, and that would also have had skin damage from the front.
All right, so that leads us into our next natural question is, how else other than sunblock could we help protect our beautiful complexion? Is there any foods or any creams that we could use? That's a $1 billion industry worldwide.
So it is, and there's so much information out there about it. Lots of things are marketed, so you do have to take many of the things you get with a grain of salt. What I wouldn't mind with is dealing with a little bit of food.
Yes.
So we have a lot of foods
Yeah.
that we can use to help maintain healthy skin.
Okay.
So one of the favorites in Trinidad, avocado, or what we call
Yes.
sabuca.
Yes. Love it.
Sabuca has a lot of very nice things that are good for your skin. They have a lot of healthy fats, they have a lot of vitamins. So your fat-soluble vitamins, they help them absorb vitamin A, D, E, and K. A lot of these vitamins, like vitamin E, they help protect you in terms of sun damage. They help that elasticity of the skin.
Right.
Vitamin C, very, very potent in terms of you've had a bit of free radical damage, sun damage. It helps reverse and block some of those things.
Right.
So when you're looking at food, so avocados are wonderful. A lot of our cold water, our fatty fish, so things like herring, mackerel, salmon,
Yes.
those things have a lot of healthy fatty acids as well. Healthy oils, things like olive oil. Again, they help with a lot of that moisture content, that elasticity of the skin. It contains a bit of vitamins as well, vitamin E's, vitamin K's, and so. Nuts, seeds. These have a lot of components that pretty much slow down aging.
Okay.
Right? Yogurt. Now, there's a concept that has been making its way around the world recently. There's a gut biome, and the gut biome, it's your skin and most of your body has a link directly to your gut in terms of inflammation. A lot of skin problems, eczema, dermatitis, autoimmune conditions, there is a link with inflammation, and therefore, if you have a healthy gut biome, theoretically at least, you should be able to limit some of this inflammation. And one of the easiest ways to that is probiotics. So yogurt is good, probiotic yogurts especially. Now sugar is an inflammatory component. So low sugar or no sugar yogurts are going to be better. You have things like your tomatoes. So tomatoes have a lot of antioxidant potentials. They have a lot of components that help limit that sun damage. So vitamin C is one, but you have lycopene as well. And for all of our local listeners, you know those who love their tomatoes, Choka? Yeah, go crazy. These things are going to keep you young. It's healthy, it's low calorie. So chocolate. Now, everybody wants me to say chocolate, but not just any chocolate. Go for your dark chocolates, because the chocolates have a lot of flavonoids that do help,
Right.
but then again, you're limiting sugar, so you don't go for the milk chocolates, it's more for the dark chocolates to get the effect. And then one of the most important things for all skin issues, hydration.
Right.
So lots of water.
Right.
And if you're not having water, you can have foods that contain water. Watermelons and cucumbers are notorious for just hydrating your skin and giving you that beautiful complexion.
Okay, all right. Shiva, now is a good time to take another break. Guys, so we just want to take another break. We're here with Dr. Shiva Tewari, dermatologist. And yet again, send in your questions and your comments to us, and Dr. Tewari will do his very best to answer them. All right, guys, we'll be back in one moment.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
Guys, welcome back. We're here with Dr. Shiva Tewari. We're talking about skin diseases. Shiva, one of the common things that we see in general practice here in Trinidad, and it's something that's a bit troubling for patients. It's very common in the Caribbean. We see keloid scars. Can you explain what is a keloid scar and what is the treatments available for persons who suffer from this condition?
Right. So keloid scars, as the name implies, they are scar tissue. Now, what's supposed to happen, you have an injury, your body seals it off with a bit of scar tissue. Now, let's say you, comparatively, had a hole in your driveway.
Yes.
You hired somebody to come fix the hole.
Yes.
Your expectation is they bring a bucket of cement, they fill it, they smooth it out. Wonderful, you have nice, smooth driveway.
Yes.
But life doesn't always work so nice.
Not in Trinidad.
Not in Trinidad.
Yeah, go on.
So he brought 3 buckets of cement. He
He
only needed 1. He poured out the first one, it was nice and smooth, but he doesn't want to carry back cement to harden in his bucket, so he threw out number 2 and number 3.
Right.
So now, instead of a little smooth surface, you have a nice bump in the area.
Right.
So it's an overgrowth of scar tissue beyond what you need.
Right.
So Josh, if you could just put up slide 37 for me, please. So you have different types of keloids. They can overgrow to hugely different extents. In Trinidad, we call them cherries or plums on the ears.
Yeah, I've got some of them there.
Yeah, so a lot of times, especially after you've pierced your ears, there's a tiny little hole from the piercing, but look how big that has become. So all of those things there, it's just overgrowth of unnecessary scar tissue.
Right.
Right? So in terms of the treatment, so
because I mean, sometimes it's unsightly. The patients want to have it treated.
Yeah.
How do you go about that?
Right. So in terms of treatment, there are a few things you can do at home.
Okay.
So in terms of home, so these are areas where it's thickened or scar tissue. If you do routine hydration of the area, sometimes you soften them up and you do help shrink them a little bit.
Okay.
So routine use of moisturizers or what we call emollient creams.
Right.
You massage them.
What like oils and stuff?
So yes, you can use oils, you can use things, even like coconut oil. We love coconut oil in Trinidad.
Aloe vera as well, people that can help.
So aloe vera will have a moisturizing potential, but I haven't seen it recommended specifically for keloids.
So you say like coconut oils and that kind of
oil,
stuff.
a little bit of Vaseline, petroleum jelly.
Petroleum jelly is
a lot
common.
of the hydrating creams that we have, there are many brands that are sensitive skin.
Yes.
You get a thick, greasy something, you turn the jar upside down, it doesn't fall out. Something nice, thick and greasy, and you just gently massage it each day, a little bit, a few minutes a day, and it softens up for many people over time.
All right.
There's silicone-based products. They have scars and they have pads, those help. And for doctors, we inject them usually with steroids to help shrink them down.
It's steroids.
Steroids.
And steroids will shrink it down. Injection of steroids. And is there a surgical option for it?
So there are surgical options for it. Surgery really should be a last resort. So, and it's a good point that you brought up because many patients make the mistake. I don't like how this looks, so I'm
for
gonna cut
example.
it. So I don't usually recommend cautery. It's a bit more traumatic. So usually it's cut out. Now, the problem with cutting, there's a 50% chance it's coming back.
Right.
And there's a 50% chance out of that it's coming back bigger.
Right.
So what I would say is you need somebody who knows the extraction of keloids. When you take it out, when you're finished, you do inject it again with steroids to help limit the chance of regrowing more than normal.
All right. How effective is the steroids?
So from my experience, and I've done quite a lot of these, it's variable.
Right.
So I've had patients with huge keloids. So here's the joke about it. One of the problems with steroids is they tend to cause a bit of shrinkage or breakdown of the skin. But you have too much skin, you have too much scar, so breaking down in that case is a good thing.
Exactly.
So I give a little bit of steroids. Some patients, huge keloids, they shrink down in 1 dose.
Right.
And other patients, tiny keloids, and 4 doses later, they're now shrinking down to half the size.
All right.
So it's very variable, but I've had really good effects with, I would say, maybe 75 or 80% of patients with steroid injection directly into the keloid, and very little of that now comes into the body at any rate to cause internal effects.
Okay.
So good
It was
effects.
localized to the scar.
It's localized to the scar.
All right. I think we have a few questions there, Doc. Josh, if you could go ahead and bring up the questions, let's get your feedback, please. What cream can I use for dark elbows?
Right. So here's one of the issues we have in terms of treatment of the skin.
Yeah.
A lot of skin problems look very similar.
Yeah.
So what they use for treatment of this should be what is the treatment for the condition.
Yes.
So if it is your dark elbows are caused by post-inflammatory hyperpigmentation.
What does that mean
It's a
in
really
English?
big set of words there.
Yeah.
So post means after
Yeah.
any inflammatory thing,
Yeah.
eczema, psoriasis, fungus.
Yeah.
Hyper is increase in
Yeah.
the pigment or the color.
Right.
So if you've had that simply based on that, you can use vitamin C based creams. A lot of those help with lightening.
Yeah.
There are some prescription strength things which have bleaching or lightening agents
Yeah.
that you can use. I don't usually recommend doing that without being seen and diagnosed first
yeah.
by somebody who knows about it.
Right.
But what helps almost everyone, a bit of moisturizer.
Yeah.
So a lot of the areas they're thickened, and
Yeah.
that's what shows the darkness.
Yeah, so
So,
in-
smoothing them out helps.
Yeah, so in general practice, you get a common thing, person come in with the elbows really dry, and might have a dark area around there. And dark areas around the elbows usually due to friction and probably an area that's not moisturized
Yeah.
effectively. So sometimes the advice I give to people is, hey, let's use some moisturizers on the elbow and be conscious of it. And once you put back in the moisture in the skin, the complexion will lighten to a certain extent.
Yep.
And will feel more less dry and uncomfortable.
Yeah.
Because that could certainly happen. Would you agree with that, though?
I would absolutely agree with that.
Yeah.
So the
Given that the condition is a dry skin condition.
So it's so dry skin, and from what you're saying as well, so that condition is called lichen simplex. So the lichen or lichenification means thickening. Your body is really smart, you know. If you keep rubbing an area, it breaks open, and then bacteria and infection can get in.
Yeah.
So as a protection against rubbing against the surface,
Yeah.
your body creates a shield.
Yeah.
Now that shield is created very quickly. It's very densely packed skin, and it becomes a bit darker than normal.
Right. And I'd just like to put out as well, because you're taking questions in a field which is dermatology, where you really need to be seeing, you actually need to see what the person is talking about. So I want to put that out there right now, that you just basically just giving some broad spectrum advice, not necessarily relevant to a person's medical condition, because it's really grossly unfair to expect you to diagnose something without actually seeing the person in front of you. Right? So these questions that come to you speak to the conditions that it may possibly be, and not make it relevant to a person who is particular condition. So you could go ahead there, Josh, and bring up the second question. I was recently diagnosed with vitiligo. Can you explain a bit more about this condition, please? No problem. That's a reasonable request.
Right, sure, not a problem.
What is vitiligo?
So vitiligo. So the most famous person we know with vitiligo, of course, Michael Jackson.
Right.
And so what the condition is. So it's really good to relate things you don't know to things that you do know, and that's how understanding occurs.
Yeah.
So in Trinidad, we have a police force.
Yeah.
Most of our police force, they do their job. But every once in a while, you will find one of them is involved in the kidnappings or involved in taking bribes.
Yeah.
So it doesn't mean the police force as a whole is a problem, but you have one rogue element.
Right.
Now, in your immune system, which is your body's police force, you
Right.
also sometimes have that one rogue element.
Okay.
It's sworn to protect all the cells,
Yes.
but sometimes they damage the cells.
Right.
In vitiligo, the cells that are being damaged are your pigment cells.
Right.
So what happens is they knock off those pigment cells, you lose the color in the area.
Okay.
Now the upside is it's not dangerous, it's not cancerous,
Okay.
but it is absolutely very cosmetic.
Right.
So in those situations, so that's essentially an unnecessary overworking of the immune system in that particular
And I
area.
must also add in that we cannot predict the sequelae of vitiligo. Because this immune system might be slow, it might be big. I mean, not everybody's going to end up as the greatest example of, for example, Michael Jackson. Because I have patients with just one little spot on a finger, and I've been seeing them for 20 years now, or 15 years now, and it just never moved from there. You know what I mean? And the diagnosis is correct.
Correct.
So the sequelae, sometimes people get scared when they have vitiligo.
Of course.
Because they see the pictures of Michael Jackson and they see different people who have totally lost their color. But that is not necessarily the case for everyone.
Correct.
And it's a lot of times it really does not really affect anyone. You just see a little spot somewhere.
Correct.
Am I correct in saying
You
that?
are absolutely correct. So as we say with the media,
Yeah.
the nice young gentleman helping the old lady cross the road doesn't make front page, you know, unless a car hits them. So, but that's how it is. So the worst of the worst is what you're going to see on the internet. The worst is on the media.
Yeah.
I have had dozens and dozens of children who have come in with vitiligo. and sometimes it self-resolves. So
Okay.
just like in Trinidad, you pick up, the immune system looks for them, it picks up on what's not doing its job, and sometimes they
It
catch
regulates
itself, it regulates itself, you're back to normal.
The body's a fantastic thing. It
It's
repairs itself a
wonderful.
lot of the times once you do
Right?
insult it.
Yeah, God knew what he was doing.
Exactly. No. Josh, next question, please. What is the difference between an age spot and a mole on the face?
Right. So in Trinidad, we use the word mole very, very, very broadly.
Of course. Yeah.
An age spot. So classically, if we're talking age spot, there's two age spots we talk about. So your liver spots.
Yes.
These are things called seborrheic keratoses.
Yeah.
Now, usually they're very dark.
Yeah.
They do occur on sun-exposed areas. The
Yeah.
face, to be honest, the reason I have this really nice beard is because I have one right here.
Yeah.
You just can't see it.
Yeah.
And they usually start to flat and they start to get bumpy. The
Yeah.
top of them kind of look like a little broccoli or cauliflower.
Yeah.
So what that is, again, coming back to our concrete.
Yeah.
So some people mix their concrete with one formula, other people with a bit more gravel. So it's normal skin with a bit more gravel in it. So it's
Okay.
benign, it's
Correct.
not really worrisome,
Okay.
but you get this bumpy texture and it might be a bit darker.
Right. That's the
That's the age
Age
spot.
spot.
So the correct name is seborrheic keratosis.
Good.
Now moles. Now moles can be a variety of different things. Most people, when I hear moles here, so I mean I have a few of them here as well, they're what you call dermatosis papulosa. Now those, again, they're overgrowths of the normal skin. They're genetic. We have a huge component in our populations down here, especially the Indian and the African-based populations. They're very benign, whereas the age spot, the seborrheic keratosis, can grow quite large. Most of these, they hit a maximum size and they stop, but they're both benign.
All right. Let's go ahead, Josh. I think we have about 2 or 3 more questions. Let's get feedback. What product should I use to help with aging? I suppose if one product would be sunblock.
Sunblock,
In
absolutely.
this part of the world, maybe a moisturizer,
Right, so sunblock, moisturizer, so
and the foods that you were describing.
the foods you're describing as well. So a good healthy diet is one of them. Now there's a lot of research over things like the vitamin A derivatives again, so retinols and retinoids. You can incorporate some of those into your routine at night as you get a little bit older, and many times using those products will help slow aging as well. The main thing to understand about them, don't expect miracles. They will help to an extent, and they're sun sensitive. So don't put them and go out into the sunlight because most times your face will turn red.
Okay.
So only at night time for those things, but sunblock, 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 and then anything else
All right,
afterwards.
and I think that picture was pretty dramatic to back up your point as well.
Yeah.
Next question there, Josh. What food should I stay away from to help with my acne? Go ahead there, Doc. I think.
Right, so we covered a little bit of
Yeah, you
that
can just
before.
repeat it briefly.
So the main things you're looking at are what we call foods with a high in the glycemic index. So things that are very sugary, especially simple sugars. Simple sugars, they are pro-inflammatory. They boost inflammation in the body, and a lot of those. Acne is an inflammatory process. It's going to make that, as well as things like eczema, psoriasis, etc., worse. And then dairy products. So foods high in dairy tend to make acne a little bit worse as well.
All right, Josh. You can give me a little feedback there, Josh. Does Vaseline help with dark circles around the eye? What can I use? Dark circles around the eye, pretty common in Trinidad.
Yeah.
Lack of sleep.
So lack of sleep, one of the major things. Few people get enough sleep in the first place. We live in a very different world nowadays. They're one of the hardest things to treat, in fact. So there are many factors that contribute to the darkness. Again, genetics, the shape of your face. So a lot of the eyes, they're in this little bit of this concave here. So when light comes, it illuminates here, and here falls in darkness.
Okay.
If you have light shining from your front, many people realize they don't have those dark spots again.
Right.
So as you get older, you may also get puffiness, which sometimes shows as darkness.
Right.
You may lose a little bit of the tissue under there, and that tends to show as darkness as well.
Right.
So what you can do, like you said, the Vaseline is good. A good hydration to your skin,
Yeah.
that's going to help. Sunblock, again, very important.
Yeah.
Many of the things that will work for other areas of the face, I do not recommend under the eyes
Yeah.
because it's very, very sensitive tissue.
Yeah.
It's much more likely to be burned or irritated by
And
things.
it's close to the eyes as well.
Correct.
Close to the visual part.
So most times, I mean, do the correct things. Healthy diet, get a good bit of sleep. For patients who it's really bad and you have something, especially if it's caused by that dip in the skin, some of the dermatologists, they do fillers. So they actually put a little bit of substance under the eye and push up the skin a bit.
Okay.
But those things aren't permanent. They will help you for a time and the body breaks it down. So you can do it over and over. But most times, I mean, basic stuff: hydration, sleep, diet.
Okay. Probably final question there, Josh, please. Why does my wife love to burst my pimple? Can't help themselves.
I can tell you,
She
it's
like to
not
say in
only
pain.
yours.
I don't know. That's what wives do.
Yeah. So, I mean, as we're on it,
Yeah.
one of the best pieces of advice: your nails have some really bad bacteria. Usually,
Yes.
it's worse than your face.
Yes.
I remember I had a cousin whose name I won't call, who were at the beach and they had their hands in the sand,
Yeah.
and I came onto the beach and they've come to burst my buttons.
Yeah.
God alone, which creatures
Yeah.
were in
Really
that sand
sad.
before.
Yeah.
So.
And you could infect the skin, basically, is what you're
Correct.
saying.
So whenever you are going to interfere with the skin, I mean, don't do it, but if people are insistent
Yeah.
on doing it, wash your hands. Get rid of all the extra bacteria you can get rid of before you go to interfere with it.
Yeah, because you don't want to burn.
And for your wife, because she likes to see you look good. So she's trying to take care of little blemishes because she wants you to look perfect. Take it in that aspect.
All right. Well, with that, we'll leave it off there for tonight, Doc. So, Shiva, I'd just like to thank you very much for coming in tonight. You delivered a hard topic. Dermatology is hard to describe and without actually just having somebody in front of you. We didn't cover the huge, vast topics that we had discussed prior to coming on air. However, whatever topics you did discuss, I think you delivered it to completeness so that there will be no ambiguity in someone's head out there in the audience. And I think the message went across, and I think people got the message. And I'd just like to thank you very much for coming in tonight. And as my guest, and the first guest for the year, if you just had any general advice to the public out there in terms of dermatology, now is the opportunity to say it in a few words.
All right. Well, thank you for having me. For all the guests, thank you for joining me. Dermatology, a simple advice, and this maybe not just for dermatology. When you're going to treat a condition, first, you should know what the condition is. If you're going to take medications for the condition, the medication should be based on what the condition is as well.
Yeah.
So if you have a fungal condition, antifungals.
Yeah.
If you have an overgrowth of bacteria, then antibacterials or antibiotics.
Yeah.
So if you have a dry condition, you're going to do a bit more moisturizing.
Yeah.
So you have every right as patients to know what goes on and what goes in your body.
Yes.
When you get medications, don't be afraid. We are doctors, we're here to help you. That's our job.
Yes.
Ask us, what is this medication you're giving to me, doc? What's it for? And you may not remember the name terbinafine or the name itraconazole, but you remember, okay, so doc gave me an antifungal cream and I need to use it this many times a day. This is what to expect. It should clear up in this much time. So know your condition, know your treatment, and don't share your medications, please. So some medications, they can cause absolutely massive effects. So lots of things look very similar. If you take an eczema treatment and you use it on a fungus, you can absolutely cause that fungus to get 10 times worse.
Okay.
So know your condition before you go and don't share if possible.
All right. Thanks a lot, Shiva. That's very nice. All right, guys. So thanks again for tuning in tonight. Thank you at home for sending in your questions to Dr. Tewari. And thanks for joining us back again in the new year. So we'll see you again next week, guys. Take care. Have a pleasant evening. Enjoy your day. God bless. Keep safe, everyone. And we'll see you again next week. Take care now. Thank you very much, Doctor.